Good evening, and warm greeting to everyone joining us today. I am GGV Gobinath, Administrator at VIAMS, Dr. KV Vijayan Institute of Ayurveda Medical Science Private Limited, and I will be your host for today's webinar titled Let's Talk About Alzheimer's. We are honored to have distinguished panel of experts with us. Specialists, physicians and specialists have multiple disciplines all sharing one mission to bring clarity, compassion, and holistic solution to Alzheimer's care. Today, we are not just here to discuss a disease. We are here to understand a journey that affects patients, families, caregivers, and society as a whole. Alzheimer's is not just a medical condition. It is an emotional challenge, a social responsibility, and a shared human experience. And together, thorough knowledge, empathy, and integrated medical wisdom, we can transform the way we care. We are blessed to have with us a team of exceptional experts from VIAMS, specialists who have dedicated their lives to neurodegenerative care, patient centered healing, and integrative Ayurvedic medicine. Before we begin, I would like to thank every participant, caregivers, medical professionals, students, and members of general public for being with us. Your presence shows your commitment to awareness, compassion, and better healthcare. Today's session structure. Let me briefly walk you through the follow of today's 120 minutes webinar. We begin with a powerful keynote address by our Chief Physician and Managing Director, Dr. Vijit KV, focusing on the science, the statistics, and the integrated Ayurvedic outlook on Alzheimer's, followed by a heartfelt session on caregivers' well-being by Dr. Needu S. Jit, a very special initiative of VIAMS. Then we move through expert segment by our resident medical officer, Dr. Aditya Tangapan, our healthcare advisor, Dr. Prasida AP, our speech therapist, Mrs. Dilna Sultana, and our clinical psychologist, Dr. Anoop CD. After our sessions, we will have an open Q&A interaction, and I encourage all participants to share their questions in the chat box. As we begin, I request everyone to stay present, open, and empathetic. Whether you are a caregiver and healthcare practitioner or someone seeking awareness, today's knowledge can truly change someone's life. Now, with immense respect and a great pleasure, I invite our keynote speaker, Dr. Vijit KV, Chief Physician and Managing Director, VIAMS, a visionary in neurodegenerative care management and a pioneer in integrated Ayurvedic approaches. Doctor, the virtual stage is all yours.
Namaste. Good evening to everyone joining us. Thank you, Gigi, for the wonderful introduction. First, let me thank you, one of taking the to be a part of this meaningful conversation. Is not it is a education that touches family itself. Our topic is Alzheimer's disease, a progressive neurodegenerative disorder, the leading cause of dementia worldwide, and a condition that has deeply affected millions of families across the globe, including many who are here today. Alzheimer's is not just forgetfulness, and most importantly, it is not a natural or inevitable part of aging. It is a disease that causes real, measurable biological changes in the brain. Over time, these changes affect memory, thinking ability, emotional stability, communication, and eventually independence. When we speak about Alzheimer's, we are speaking about a condition that slowly takes away a person's ability to live the life they once knew. But we are also speaking about a condition where early awareness, scientific understanding, integrative care, and continuous family support can make a powerful difference. Tonight, my intention is simple to help you understand what happens in the brain, what modern medicine offers, where the gaps are, how Ayurveda and integrative strategies can step in, and how we can provide dignified, compassionate, evidence-formed care. Let us beginning. Let us begin this session by looking a big picture how Alzheimer's has evolved globally and in India over the past 25 Alzheimer's has been rising at an alarming rate worldwide. In the last 25 years, we have seen a dramatic shift in the epidemiology of dementia. Globally, people are living proper and while longer, and while longevity is blessing, it has also resulted in a greater number of individuals reaching ages where Alzheimer's risk significance. Countries close to the United States, China, and Japan have recorded unparalleled increases in dementia prevalence. But what is truly striking is a rapid rise in low and middle income countries, especially in South Asia. India, with its huge aging population and changing lifestyle patterns, is now witnessing one of the fastest increases in dementia numbers. In India, the problem is magnified for several reasons. First, awareness is very low. Early symptoms such as misplacing objects or repeating questions or difficulty recalling recent conversations are often missed as old age. Families tend to seek help only when the symptoms become very severe, by which time intervention options are limited. Second, the stigma and the denial, daily delay diagnosis. Many families feel embarrassed talking about memory problems, fearing social judgment. This result in late presentation when functional abilities have already worsened. Third, we have a significant treatment gap. Access to neurologist, geriatric specialist, neuropsychologist, and trained caregivers is limited outside metropolitan cities. So, even where specialists are available, the cost of consultations, diagnostics, and long term care is often unaffordable. Fourth, modern lifestyles, chronic stress, sedentary work patterns, poor sleep hygiene, increased metabolic disorders have contributed to greater cognitive decline risk. During the last 25 years, one more shift has occurred. Caregiving has become increasingly challenging. Earlier, joint families shared their caregiving responsibility. Today, with the nuclear families, migration for employment, and changing social structures, caregiving stress often falls on one or two individuals, leading to burnout, emotional strain, and financial pressure. So, the rise in Alzheimer's is not just a medical challenge, it is a societal, emotional, and economic challenge. But to create effective solutions, we must look ahead at what the next 25 years could like. If we continue on the current trajectory, the next 25 years will likely see a substantial rise in Alzheimer's cases worldwide. With advances in healthcare, more people will live beyond 70 and 80, but this also increases the number of individuals who may develop cognitive decline. Healthcare systems already strained will face greater pressure, more need for long term care, homes, memory clinics, dementia units, trained nursing staff, and caregiver support systems. But here's the important part: the next 25 years also hold tremendous opportunity. We are now have better understanding of biomarkers, genetic markers, early diagnostics tools, and risk notification strategies. We also have emerging disease modifying therapies and an increasing global emphasis on integrative health, brain healthy lifestyle, and person centered care. If we begin early, even before symptoms appear, we can delay the onset, slow the progression, and significantly improve the quality of life. This is where integrative models, community based interventions, caregiver education, and culturally rooted systems like Ayurveda can play a groundbreaking role. Before we explore integrative options, let us understand what modern medicine currently offers and where its limitations lie. So, modern medicine has significant progress in understanding the biology of Alzheimer's. We now know about amyloid plaques, tau angles, neuroinflammation, mitochondrial dysfunction, synaptic loss, oxidative stress, and vascular contributions. However, despite these advances, modern medicine still faces critical limitations. First, most available medications provide symptomatic relief, improving attention, mood, or daily function, but they do not stop the disease. And in modern medicine, there is no proven medications or therapies for the prevention of existing healthy brain cells. Second, these advanced therapies come with side effects such as brain swelling or microbleeds, necessitating MRI monitoring, which is not always accessible in India. Third, the cost of the treatments is extremely high, making them inaccessible for the majority of patients in low and middle income communities. Fourth, Alzheimer's is not just a neurological disorder. It affects emotional health, social functioning, sleep, nutrition, physical strength, and relationships. But the medical model tends to focus primarily on pharmacology, living lifestyle, diet, caregiving, and psychological health under addressed. Fifth is diagnosis often happens late. Many patients come to specialists when behavioral changes or functional decline is already advanced. At this point, the effectiveness of modern drugs is limited. And finally, Alzheimer's is a multi pathway disease affecting inflammation, oxidative stress, vascular health, sleep cycles, metabolic function, and much more. Relying on a single drug mechanism is rarely sufficient. This is exactly why integrative medicine, especially Ayurveda, with its multi target holistic philosophy, offers tremendous promise. Let us now move to the Ayurvedic understanding. Ayurveda conceptualizes cognitive decline in a completely different yet beautifully complementary way. While modern medicine looks at a plaque accumulation or neuronal degeneration, Ayurveda looks at the body mind field and the underlying imbalance affecting mental clarity and memory. Alzheimer's aligns closely with Vata aggravation, impaired Dhatu nourishment, and disturbance in Manas. Ayurveda views memory, that is smriti, cognition, that is di, and consciousness, the chitta, as an interconnected functions supported by proper digestion, circulation, cellular nutrition, emotional balance, and the pranic flow. So the Ayurvedic approach focus on three key principles. First, Medya Rasayana therapy. So, Medya Rasayana, these are the cognitive enhancing herbs like Brahmi, Ashwagandha, Shankapushpi, Yeshtimadu, which nourishes the nervous system, support the synaptic function, and promote calmness and clarity. Second is the Rasayana therapy, that is the long-term regeneration and tissue nourishment aimed at improving vitality, immunity, and mental resilience. So the Rasayana supports urges the essence responsible for mental stability and well-being. The third is the holistic correction of lifestyle through ahara, our diet, vihara, our daily routine, yoga, pranayama, sleep optimization, stress management, and emotional grounding. So, an important difference is that the Ayurveda doesn't look at the brain in isolation. It looks at digestion, gut health, liver health, metabolic balance, sleep cycles, sensory overload, emotional stress. All factors now scientifically proven to influence cognitive function. Thus, Ayurveda naturally takes a multi targeted, preventive, and rehabilitative approach, something modern medicine is only beginning to appreciate. So, now let us examine how specific Ayurveda herbs work at biological level. Let me discuss three of most scientifically researched medicines. The first one is ashwagandha, that is the Withania somnifera, is the scientific name. So, ashwagandha is widely recognized for its adaptogenic properties. Studies show its ability to reduce the cortisol levels, modulate stress pathways, and protects neurons from oxidative damage. Preclinical studies demonstrate neuroprotective effects, improvement in synaptic density, and reduction in neuroinflammation, all essential for long term cognitive health. So, for Alzheimer's, this helps manage behavioral symptoms, anxiety, sleep disturbances, and neuronal resilience. Next is Brahmi, Bacopa moneri. So, Brahmi is a classical cognitive enhancing herb. Multiple randomized trial shows improvements in memory acquisition, retention, recall, and attention. The bacopa contains bacosides that support neurotransmission, reduce oxidative stress, and enhance synaptic communication. So these mechanisms are extremely relevant in Alzheimer's, where synaptic breakdown begins long before memory symptoms appear. Next is turmeric or curcumin. Curcumin is one of the most intriguing compounds in natural medicine. It reduces neuroinflammation, inhibits amyloid aggregation in the cell models, enhances antioxidant defenses, and improves mitochondrial function. So, through the bioavailability is a challenge. New formulations show better absorption in clinical relevance. So each of these herbs work on multiple pathways simultaneously, that is the inflammation, stress, oxidation, neurotransmission, and synaptic health. This multi-targeted mechanism is exactly what Alzheimer's demands. Now let us move from herbs to lifestyle, a core pillar of integrative management. So, uh, lifestyle medicine plays a profound role in preventing and slowing cognitive decline. Regular physical activity improves neuroplasticity. The medication reduces stress hormones and enhances connectivity in memory related brain regions. Yoga stabilizes mood, improves balance, and regulates sleep, all essential for Alzheimer's patients. Diet plays a major role, reducing inflammatory foods, increasing antioxidants, ensuring healthy fats, herbs, and spices all promote brain health. A sattvic, balanced, home cooked diet supports digestion and enhances mental clarity. Sleep optimization is very crucial. Disturbed sleep accelerates amyloid accumulation. Deep sleep acts like a cleansing cycle for the brain. Ayurvedic daily routines, early rising, regular meals, mindful eating, controlled screen exposure, grounding exercises, breath work, that is the pranayama, all contribute to stability of mind and nervous system. These lifestyle elements, when practiced consistently, not only show cognitive decline but also improve emotional well being, reduce agitation, and enhance daily functioning. To bring all these components together, we need a structured system. That's where the Vyams model comes in. So, at Vyams, Dr. K.V. Vijayan Institute of Ayurveda Medical Science, we have created an integrated care pathway combining the strength of modern neurology and traditional Ayurveda, supported by physiotherapy, ASLP, psychology counseling, and dietetics. So, in our model, patients receive a complete neurological and cognitive assessment. Then the Ayurveda practitioners evaluate dosha imbalance and mobility rhythms. The physiotherapist support mobility, balance, and functional independence. Speech and language therapists help with communication, swallowing, and cognitive exercises. Psychologists support emotional well being, caregiver counseling, and behavior management. Nutritionists curate brain health, culturally acceptable diets. So each patient receives a personalized plan that adapts as their condition changes. So our focus is not only on the patient's brain health, but on the caregiver's mental health, home environment, diet, sleep hygiene, stress levels, and overall quality of life. So the VIMES model is continuous care approach, not a one-time intervention. This is what Alzheimer's requires. So there is hope because global interest in integrative dementia care increasing rapidly. Research is now beginning to explore Ayurveda herbs, lifestyle therapies, pranayama, meditation, and personalized nutritional interventions for cognitive health. But we need more robust trials, more collaborative studies, more integration between Ayurveda institutions, neurology departments, and research bodies. Evidence must continue to evolve. At VAMS, we commit to building this evidence base, contributing data, conducting structured programs, and collaboration with partners to create scientifically validated integrated dementia care protocols. This combination of tradition, modern science, data, and compassion will shape the next era of Alzheimer's care. So, as I conclude my session, I want every family, every caregiver, and every person listening to remember one simple truth: you are not alone. Alzheimer's may change a person's memory, but it never reduces their dignity, their worth, or the love we hold for them. There is no cure yet for Alzheimer's, but there is care, there is support, and there is hope. Through early detection, integrative therapies, structured lifestyle practices, family education, and compassionate long term support, we can improve the quality of life and create meaningful moments for the patients and families. Thank you for being part of this session. So, the next session will be handled by Dr. Needu Sjit. So I welcome Dr. Needu to deliver your session. The screen is yours.
Namaste, everyone, and thank you for joining. Caring for patients with Alzheimer's or other forms of dementia is never easy. Sometimes patients even refuse the very care they need, and that creates enormous stress for families and caregivers. Many patients are not even aware of the changes happening in their own memory or thinking. This condition is called anosognosia. Today, let's talk together about four important things: how to communicate effectively with Alzheimer's patients, general caregiving strategies, how families and caregivers can cope with the challenges they face, and last, Vyam's approach in Alzheimer's caregivers' health. Let's look Alzheimer's prevalence. As life expectancy rises and populations grow, experts warn that the number of Alzheimer's patients will increase rapidly in the coming year. That means doctors, nurses, and caregivers will be interacting with more patients and families than even before. And that makes caregiver health and support even more critical. Now, let's look at the different care approaches available. First one, in-home care. This allows the patient to stay in familiar environment. Family members, friends, or home health aides can share responsibilities, and it reduces stress for the family. Second, adult day centers. Sometimes caregivers have jobs or other commitments. Day centers provides a safe, engaging environment for patients during the day. Third, long-term care. As the disease progresses, some patients need 24-hour care. Options include nursing homes or assisted living communities. Fourth one, respite care. This is a temporary care that gives caregivers a break. It can last from a single day to several weeks, and it helps caregivers rest physically and mentally. The last one, hospice care. When the patient reaches the end of the life stage, hospice care focuses on comfort, dignity, and emotional support. This can be at home or in adult care facility. Think about this. Which of these approach would best fit for your family situation? Each has its own strength. Now, let's move to the practical tips for caregivers. First, educate yourself. Learn about your loved one's condition. Attend the medical appointments, ask questions, and understand the changes in behavior. Knowledge reduces your fear, and when you know what's happening, you feel more confident and less overwhelmed. Second, set a daily routine. Simple routines, bathing, dressing, meals at the same time each day brings stability. For patients, routine is comfort, and caregivers, it reduces stress and uncertainty. Third point, keep them physically active. A short walk, gentle stretches, or even light household tasks can make a big difference. Exercise slows decline, keep the body healthy, and improve mood for both patient and caregiver. And fourth point, keep them mentally active. Reading, puzzles, sudoku, or chess. These activities stimulate their brain and, wherever possible, allow independence. Even small decisions help patients feel capable. Fifth point, let's talk about food because what we eat shapes both body and mind. A balanced diet is essential for Alzheimer's patients. Their meals filled with leafy greens, berries, whole grains, fish, and chicken. These food nourishes the brain and strengthens the body and keep energy steady. At that same time, it's important to avoid excess sugar, red meat, and fried foods. These can weigh the body down and make symptoms harder to manage. So, when we promote nutritious eating, we are not just feeding the body, we are supporting memory, mood, and overall well being. Sixth point, let's talk about choices. Small, simple choices can restore a sense of control. Instead of deciding everything for them, invite them to choose. For example, ask, would you like the blue shirt or the white shirt? These kinds of choices are easy to answer, yet they give patients a voice in their own care. And that voice builds confidence, dignity, and self worth. Because at the heart of caregiving, it's not just about doing things for them, it's about empowering them to still be a part of the decision making in ways that feel safe and supportive. 7 point, promote good hygiene, daily bathing, brushing teeth, grooming hair, and clean clothes. Boost self esteem and prevent infections. Involve patients in small tasks like combing their hair and choosing clothes. 8 point, let remember the importance of patience. With Alzheimer's, everyday tasks often take longer. That is dressing, eating, or bathing. Everything slows down. The key is to avoid rushing. When we rush, we create stress. But when we slow down, we create space for dignity. and admires the small success. Even something as simple as holding a spoon independently is a victory worth celebrating. Because for the patient, these small steps are big achievement, and for the caregiver, recognizing them turns to frustration into encouragement. Ninth point, let's talk about the communication. It's an important point. When speaking with someone who has Alzheimer's, the way we communicate matters just as much as the word we use. First, reduce background noise. A quiet environment helps them focus and feel less overwhelmed. Second, speak face to face gently and clearly. Use simple words, keep eye contact, and let your body language show support and kindness. Third point, allow time for responses. Silence is not a problem, it's patience. Giving them space to answer shows respect and reduces pressure. And here is something important, that avoiding memory testing questions like, don't you remember? These can cause frustration and sadness. Instead of this, use visual aids like photos, objects like to guide understanding. So, communication is not just about exchanging words, it's about creating connection, dignity, and trust. Point, support and compassion. Approach with love, patience, and understanding. When families and caregivers work together, patients feel safer and happier. Compassion increases confidence and creates a sense of belonging. And finally, ensure home safety. One of the biggest risks for patients with Alzheimer's is falling. So, we take simple steps, use carpets, grip strips, and handrails to make walking safer. In bathrooms, non-slip mats are essential, and always keep walkways clear and well lit. Clutter and darkness can quickly lead to accidents. Hazardous items should be locked away, and for added security, install lock or alarm on doors and windows. These measures help prevent wandering and keep patients safe. And here is a very important reminder: patients with severe cognitive symptoms should never bath or cook alone. These activities may seem routine, but they carry real risk if unsupervised. So, safety is not about restriction, it's about creating an environment where patients feel secure, family feel reassured, and caregivers can focus on care with peace of mind. Next, when dementia patient refuses care. One of the most difficult situations in dementia care is when patient refuse the very help they need. This can be frustrating and emotionally draining for families and caregivers. So, now let's talk about why this happens, how we respond with compassion, and some general care strategies that make life easier for both patients and caregivers. First one, understand the reason. Refusal is not stubbornness. Often it comes from something deeper. Sometimes it's physically discomfort, pain, fatigue, or illness. Other times it's emotional, fear, anxiety, or depression. And often it's simply the process itself, unfamiliar people feeling rushed or pressured. So the first step is always ask yourself gently, what might be behind this refusal? When we understand the reason, we can respond with more kindness. Second point, approach with compassion and love. Let's remember that care must always begin with compassion. It's not only about what we do, it's about how we do it. Use a gentle voice, let your body language be calming and reassuring. These small signals tell the patient you are safe, you are cared for. Always acknowledge feelings. If they are upset or confused, say something like that. I understand this feels difficult for you right now. That recognition matters more than trying to correct or explain. And here is the truth: patient may forget our words, but they never forget how we made them feel. They will remember our tone, our patience, and our love. Third point, avoid pressure. Don't rush them. Create a calm environment. Give them time to do. Sometimes silence and patience are more powerful than word. When we remove pressure, we will space for trust to grow. Fourth point, let's talk about trust. because trust is the bridge between refusal and acceptance. For someone living with Alzheimer's, trust is built in the little moments. Familiar faces make them feel safe. Calling them gently by name reminds them they are seen. Looking into their eyes shows respect and connection. And whenever possible, involve them in tasks they can still do. Even something simple, folding a towel, choosing which clothes to wear, gives them a sense of purpose. These small acts of inclusion reminding them you are valued, you still matter. Trust doesn't come from big gestures. It grows quietly, day by day, through patience, kindness, and consistency. And once trust is there, care becomes easier, smoother, and more dignified for patient and caregiver. And if nothing seems to work, please remember you are not alone. Professional specialists can assess cognitive changes, rule out hidden health issues, and guide caregivers with effective strategies. Seeking help is not your failure, it's wisdom. It means you are protecting both yourself and your loved one. Let's talk about some everyday practices that make caregiving smoother and more comforting. First point, consistency matter. Whenever possible, the same staff or family member should provide care. Familiar faces bring reassurance and reduce anxiety. Second point, avoid frequent room changes. Unfamiliar spaces can increase confusion. Keeping the environment stable help patient feel safe. Third point, allows check for pain or discomfort. Even if the patient doesn't say it, sometimes they can't express it clearly, but their body language and mood give some clues. Fourth point, explain each step. Simple phrases like now we are taking medicine or now we will wash your hands help patient feel included and less startled. Fifth point, keep instructions simple, one at a time. Too many directions at once can overwhelm. One gentle step keeps things manageable. Sixth point, use reminders. Notebooks, calendars, or even sticky notes can help patients stay oriented and reduce frustration. 7 point, balance activity with rest breaks. Patients may tire easily. Gentle pacing keeps energy steady and prevents agitation. 8 point, use gentle cues. A soft touch during meals, for example, can reminding them to eat without words. These small gestures carry great meaning. And finally, in later stages, even swallowing may need reminders. This is the part of the journey, and with patience and compassion, we can support them through it. Next, now let's talk about something that is critical in Alzheimer's care, medication safety. First, caregivers and family members should always know the full medication list. Write it down, keep it updated, and make sure everyone involved in care has access to it. Second, wherever possible or whenever possible, involve the patient in routines. Even small participation like handing over a pill or checking the calendar builds confidence and dignity. Third point, stick to a fixed schedule. Medicine should be taken at the same time each day. Label them clearly with name, dose, and time. This reduces confusion and keep things consistent. Fourth point, use pill organizers. These simple tools prevent mistakes or make it easier to track what has been taken. Fifth point, always watch for side effects. Dizziness, confusion, or unusual changes should be reported immediately to his doctor. Never ignore these signals. And finally, store medicines safely. Locked cabinets are best. This prevents accidental misuse or double dosing and keeps patients safe. So remember, medication safety is not just about pills, it's about confidence, dignity, and protection. When caregiver manage medicines carefully, patient feels secure and family feels reassured. The next point I want to talk about something that often remains hidden behind the patient's journey, caregiver burnout. What is caregiver burnout? It is a state of physical and emotional exhaustion that comes from the constant stress of caring for someone with Alzheimer's or dementia. Caregivers may feel isolated, unsupported, or undervalued. Sometimes they neglect their own health, slip into depression, and eventually lose their interest in caring for themselves or even the patient. This is not a sign of weakness. It is a natural result of carrying a very heavy responsibility without enough support. Let's look symptoms of caregiver burnout. Persistent physical and mental fatigue, body aches or headaches, feeling isolated or unsupported, ignoring their own health, depression, losing interest in caring itself. If you recognize these symptoms in yourself or someone you know, it's important to act early. So, how can caregivers protect themselves? First, prioritize your own health. Sleep, nutrition, and exercise are not luxuries, they are non negotiable. When your body is strong, your mind can stay steady. Second point, join support groups. Sharing experience with others who understand reduces your isolation. Third point, share responsibilities. You don't have to carry this alone. Involve your family members whenever possible. Even small contributions from others can make a big difference. Fourth point, take breaks. Respite care exists for a reason. It allows caregivers to rest and recharge. Fifth point, talk to your doctor. Share your stress openly. Don't carry it alone. Medical professionals can guide not only the patient's care but also support your journey as a caregiver. 6 point, seek counseling or therapy. Professional support can help you process emotions, find coping strategies, and regain your balance. And finally, make time for yourself. Whether it's reading, music, prayer, or any activity that restore your spirit, these moments are essential. They remind you that you are more than a caregiver. You are a whole person with your own needs and joys. Because when caregivers protect their own mind and their own health and mind, they can give better care, not just to the patient, but to the entire family. So the last point, Vyam's approach in Alzheimer's caregivers' health. At Vyams, we see caregivers as the silent backbone of Alzheimer's care. They give their time, their energy, and their love, often without recognition. Our approach is built to protect their health, nurture their strength, and empower them to thrive. Let me walk you through the pillars of our approach step by step. First, education and training. We hold regular workshops where caregivers learn about how Alzheimer's progresses, what changes to expect, and how to communicate compassionately. Knowledge builds your confidence, and when caregivers feel empowered with practical skills, they can approach challenges with calm and clarity instead of fear. We also teach how to recognize caregiver burnout early because protecting the caregiver is not just as important as caring for the patient. The next point, Ayurveda and wellness for caregivers. Caregiving takes a toll on both the body and the mind. That's why we turn to Ayurveda. Now, let's break this down into simple practical steps for caregivers. First, we recommend Methi Rasayana, that is herbal support. These are the herbs known to strengthen the mind and nervous system. Some herbs are Ashwagandha, Brahmi, Shankapushpi, Triphala. These Methya herbs are tailored to each person's constitution because Ayurveda believes that every person's body type, that means Prakriti, is unique. Second point, Sattva Vijaya practices. Herbs alone are not enough. We teach Sattva Vijaya practices. That is, first one, meditation. Even 10 minutes a day can calm the mind. Second, yoga, gentle postures to release tension and improve circulation. Pranayama, breathing exercise, calming the nervous system and reducing your anxiety. Fourth point, journaling, writing down thoughts helps release emotional weight. And mantra recitations, repeating positive sounds or affirmations creates inner peace. These practices are simple, but they bring mental clarity and emotional strength, exactly what caregivers need when stress feels overwhelming. Third point, self-care routines. Ayurveda emphasizes daily routines that nourishes the body. First one, Abhyanga. Warm oil massage that relaxes muscles and improves blood circulation. Proper diet, fresh seasonal foods, vegetable fruits, and light proteins are taken. Avoid excess sugar, fried foods, and processed meals. The third point, restful sleep. Creating a bedtime routine, reducing your screen time, and calming the mind before bed. So, a caregiver who is rested, nourished, and emotionally balanced can provide care with patience, love, and resilience. Ayurveda teaches that self care is the foundation of caregiving. Fourth point, community and connection. Caregiving can feel lonely sometimes. That's why community matters. Support groups, whether in person or online, give caregivers a safe space to share and feel understood. Peer to peer mentoring is another powerful tool. Experienced caregivers can guide newcomers, offering practical tips and emotional reassurance. It's wisdom passed hand to hand and heart to heart. And through shared stories, caregivers find emotional validation. They realize you are not alone, your struggles are seen, and your efforts are valued. So, what is the result of these efforts? We begin to see a beautiful cycle of well being. When caregivers feel supported, their hearts are lighter, their bodies are stronger, and their minds are calmer. That strength flows directly into the care they give. Patients receive more patience, more dignity, and more love. And when patients feel cared for in this way, their quality of life improves. Families feel more peace, communities grows more compassionate. So, I concluding, Alzheimer's and dementia are life-changing challenges. But with love and compassion, this journey can become one of hope for patients, families, and caregivers alike. Caregivers are the strength of the patient, families are their comfort, and society is their safety net. Supporting patients and their families is not just a duty of society, it is a true meaning of our humanity. And let me end with one thought: love itself is the real medicine. Thank you and namaskaram. I now hand over to Dr. Aditya Tangapan, YM's resident medical officer, who will speak about the medical pathways of diagnosis and how we integrate modern and Ayurvedic medicines in early detection. Dr. Aditya, over to you.
Thank you, Dr. Neetu. Hello, everyone. I am Dr. Aditya Tangapan, the resident medical officer here at YMS. Thank you for giving me the opportunity to speak. My focus tonight is on early diagnosis of Alzheimer's, a critical step in care, and how we at YMS use both modern and Ayurvedic perspectives to understand the disease better and plan treatment accordingly. Why is early diagnosis important? To begin with, Alzheimer's is a progressive disease. The earlier we identify it, the more options we have to manage it. Early detection allows the patient to start medications that may slow symptom progression. It also helps in planning non-drug interventions like cognitive exercises or lifestyle changes when they can be most effective. Importantly, it gives families time to prepare emotionally, socially, and financially for what lies ahead. In modern medicine, we use several tools to diagnose Alzheimer's. Cognitive assessments like mini mental state examination or the Montreal Cognitive Assessment helps us measure memory, orientation, language, and attention. Neuroimaging techniques like MRI or PET scans can reveal structural brain changes such as shrinkage in key areas like hippocampus or the presence of amyloid deposits. In advanced centers, biomarkers from cerebrospinal fluid such as amyloid beta and tau protein levels can give us very sensitive information about disease presence and progression. But alongside all this, Ayurvedic diagnostic methods provides invaluable insights. In Ayurveda, diagnosis involves more than just physical signs. We assess the dosha constitution like Vata, Pitta, Kapha, the balance or imbalance of doshas, and how that reflects in the mind. For example, through Nadi Pariksha, that's the pulse examination, an experienced Ayurvedic physician must detect subtle energy imbalances that could signal a tendency for neurological deterioration. We also observe patterns of speech, sleep, digestion, and emotional state, since this gives clues about mental health and constitutional imbalance. Sometimes we use structured Ayurvedic questionnaires to evaluate a person's dosha profile and their mental health state, which guides how we individualize interventions. At Vyams, we don't rely on just one system. We follow an integrated diagnostic model. This means combining the strength of modern medical diagnostics like imaging and cognitive tests with Ayurvedic insights to form a more holistic and personalized understanding of each person. When we diagnose someone, we not only classify their disease stage, but also consider their constitution, mental resilience, and lifestyle patterns. This helps us design a more tailored treatment and care plan, one that includes meditation, Ayurvedic treatments, dietary and routine recommendations, perhaps yoga or meditation, and caregiver training. In summary, early diagnosis through combined modern and Ayurvedic methods gives us a 360-degree view of the patient. It enables more precise, patient-centered care and allows us to intervene in the way that honors both ancient knowledge and modern science. This integrated understanding not only guides our clinical decisions, but also strengthens our ability to support patients and families at every step of care. Thank you for your kind attention. I would now like to invite Dr. Prasida AP, our healthcare advisor, to speak about how we translate diagnosis into a personalized care plan. Over to you, Doctor.
Namaste and warm greetings to everyone. And thank you, Dr. Aditya, for the introduction. I am Dr. Prasida, Healthcare Advisor at VAMS. Okay, my role today is to help you understand how a diagnosis transforms into a practical, compassionate daily care plan, something that the patient and family can follow with confidence. So, when a loved one is diagnosed with Alzheimer's, the most common question is, what do we do next? So, a diagnosis is only just the beginning. What truly matters is how we design the day-to-day routine so that the person feels safe, supported, and understood, and the caregiver feel confident and less stressed. At VAMS, we design personalized care plans that integrate modern clinical recommendations with Ayurvedic lifestyle principle. And our aim is twofold. Firstly, support brain function and emotional well-being, and secondly, reduce stress for the family and the caregiver. Let me elaborate on how we approach this holistically. First, Ayurvedic lifestyle or dinacharya is central. So, from an Ayurvedic perspective, many Alzheimer's symptoms resemble Vata imbalance. For example, irregular sleep, restlessness, anxiety, forgetfulness, and wandering tendency. So, in order to stabilize the Vata, we emphasize a predictable daily routine, such as regular wake up and sleep times, fixed meal timings, and a quiet evening wind down rituals. Also, daily practices such as gentle abhyanga. Abhyanga means warm oil massage before bath,
then warm, freshly cooked meals, and avoiding excessive sensory stimulation in the evenings will help calm the nervous system and improve sleep quality and emotional stability. Okay, now next is diet and nutrition. So actually, Ayurveda places a great emphasis on food as medicine. So a predominantly sattvic diet means which is fresh, light, easily digestible foods, which will all support mental clarity, bring about calmness and stable mood, which is very crucial in dementia care. And we also include anti-inflammatory and brain-healthy spices such as turmeric, cumin, coriander, cinnamon, and small amounts of medicated ghee. So integrating omega-rich foods and warm soup support neuronal health and digestion, which often becomes weak in elderly patients. So caregivers receive clear guidance on what to prefer, what to limit, and how to adapt textures and portion size as swallowing or appetite changes. And we also guide families on sleep hygiene, means limiting screen time at night, avoiding stimulants, establishing calming routines such as warm milk with nutmeg, soft chants, or light stretching. And environmental support is another pillar. So Alzheimer's patients depend heavily on surroundings to feel oriented. So simple changes can dramatically improve safety and also reduce confusion, such as clear labels on doors, color-coded signs, removing clutter, using soft, warm lighting, keeping familiar objects easily visible, etc. So structured daily activities like puzzles, music, gardening, simple household tasks will all help maintain cognitive stimulation and a sense of purpose. So, our goal is to create a supportive ecosystem where the patient, caregiver, and homework work together to maintain dignity, comfort, and meaningful engagement. Thank you for listening. And I now welcome our speech therapist, Mrs. Dilna Sultana, who will guide us through communication and swallowing support for Alzheimer's patients. Over to you, ma'am.
Thank you, Team Vayams, for giving me this opportunity. So, first, we will discuss about Alzheimer's disease in detail. According to speech therapy, Alzheimer's disease is a progressive neurological disorder with a significant impact on a person's communication abilities, including language processing, fluency, and comprehension. Also, a speech language pathologist define Alzheimer's disease as a condition that causes progressive cognitive decline, leading to difficulties with finding words, which means anomia, and also semantic paraphasia, that is, using incorrect words, and reduced verbal fluency, as the brain regions which is crucial for language are damaged. Sir, the next slide. Okay. So, in Alzheimer's disease, the speech therapist use a habilitative approach for Alzheimer's patients, where the clinician will focus on managing the symptoms and improving the quality of life through techniques like cognitive stimulation, memory aids, and communication strategies. The management involves creating a supportive environment and training caregivers, while specific techniques include spaced retrieval for memory, reminiscence therapy, and language exercises to improve cognitive and linguistic skills. So now let's discuss about the therapeutic techniques that are being used in a speech therapy for Alzheimer's disease. So the first one is the cognitive stimulation therapy, where the cognitive stimulation therapy means the clinician will engage the patient in theme-based activities to improve the cognitive functions like thinking, concentration, and memory. The next one is memory aids, where the memory aids, the clinician will create tools like memory books that include personal information about the patient, the schedules, and safety strategies to help patients recall information and improve daily functioning. The next one is spaced retrieval training, where a technique a patient repeats information at increasing time intervals to improve the long-term memory retention. The next one is language and cognitive exercises. Here, the tasks are designed to improve language processing, such as categorizing the items or playing word retrieval games. The next one is reminiscence therapy. Here, the therapist will discuss the past memories and experiences to help improve recall, communication, and emotional well-being of the patient. The next one is simulated presence therapy. Here, using audio recordings, here the therapist will decrease the resistance to care and improve behaviors like taking medication or feeding. The next one is communication partner training. Educating communication partners on how to interact with the patient more effectively. And the last one is validation therapy. Here, an approach that accepts and validates the person's feelings and reality to reduce the stress and improve the contentment. Sir, next slide. Okay. So in this slide, we will discuss about the management strategies. In caregiver training and communication guidance, the clinician will be providing family members with strategies and training to help them communicate effectively with the patient and manage behaviors. Then the next one is environmental modifications. The clinician will make the patient to adapt the physical environment to reduce the barriers and improve the functions, such as improving lighting or reducing the background noise, which will be helpful for the patient. The next one is individualized care planning. Here, collaborating with the patients and families to develop a long-term care plans and communication strategies according to the stage of the disease of the patient. And the last and final stage is the swallowing support. So, for swallowing support, the therapist will assess and treat dysphagia. Dysphagia means a difficulty in swallowing both the liquids and solids. So for this in swallowing support, the patient will be providing with exercises and positioning the adjustment of the patient, and also bringing up with the modifications of foods and liquids. So now here I conclude by telling a quote. Alzheimer's makes us realize that we are not alone, that kindness and compassion are everywhere and all around us. So by understanding this quote, you will learn that you will need compassion to meet the needs of those suffering from Alzheimer's or from various types of dementia. Thank you, Team VAMS.
Thank you, Mrs. Dilna. I now invite Dr. Anup CD, our clinical psychologist, to share insights into the emotional and behavioral aspects of Alzheimer's. Over to you, sir.
Thank you. Good evening, everyone. I'm Anup CD, psychologist at IAMS. Yeah, in the next 10 minutes, I will briefly discuss behavioral symptoms in Alzheimer's disease and how psychological interventions can reduce distress for the patient and family. In our first slide, you can see behavioral symptoms. First of all, I need to say Alzheimer's is not only a memory disorder, it affects perception, emotion, behavior, and social function. Some of the most common behavioral symptoms include anxiety and agitation, especially when a person feels lost, misunderstood, or overstimulated. Second one, hallucinations or delusions. They may see someone who is not there or believe something is stolen. Third one, sleep disturbances and nighttime restlessness, which may lead to wandering or confusion. I want to emphasize one critical point. The person with Alzheimer's is not intentionally being difficult, stubborn, rude, or disobedient. They are not trying to challenge others or misbehave on purpose. They are manifestations of neurological changes and unmet emotional needs of the person. As we already told, families often feel frustrated or helpless. It is easy to think the person is being stubborn, but Alzheimer's changes the brain activities process in reality. When a person cannot understand what is happening, the most safest response emotionally is protect themselves. As we know, agitation, anger, fear, or withdrawal are signals. They tell us something is overwhelming, frightening, or confusing them. If we respond with empathy rather than confrontation, the situation diffuses much faster. When we move to the second slide, behind every difficult behavior, there is a human experience. That may be fear, confusion, loss of control, or loss of identity. Three priorities help us, as a psychologist, it helps us to work with Alzheimer's clients. Managing fear and confusion, we create a safe emotional space for them. Instead of correcting every mistake, we meet the person where they are emotionally. Supporting identity and dignity. Even when memories fade, the person's life stories remains meaningful. We speak respectfully, use their names, give choices, avoiding infantilizing language. And also the important point, supporting the family. Caregivers suffer quietly. They need reassurance, education, and coping skills. As we know, if the caregiver is calm, the environment becomes calmer, which reduces behavioral disturbances. As we move to the third slide, we can just look some therapeutic approaches. First one, as we already discussed, it is validation therapy. We acknowledge the emotion rather than debating the fact. If one of our Alzheimer's client or patient tell us, I need to go to work, definitely as a psychologist, I don't give reply like you retired already 20 years ago. We respectfully respond. I think you were very responsible at your job. What part of work do you miss? Maybe, no, not maybe. When we are acknowledging the client, it reduces the emotional storm. Second one, reminiscence therapy. As we know, the old memories are often betterly preserved in Alzheimer's client. We use photos, familiar musics, old recipes, cultural rituals. These memories reconnect identity and offer comfort. The third therapy model, redirection. When agitation builds, we gently move attention to something calming. It may be watering plants, folding towels, listening to music, or holding a familiar object. The goal is not to win an argument, but to keep the brain in a safe emotional zone. Fourth slide. Okay. When we move to the fourth slide, in addition to these psychotherapies, mind-body skills are very useful. The first one, relaxation or sensory grounding. It may be a soft cloth, a warm hand massage, a gentle touch, or calming sense, reduce anxiety. We can use what are the things we can help to reduce the anxiety of the client, and also guided imagery. Simple visualization, a garden, a temple courtyard, an ocean waves helps to regulate attention and mood. And also another one, breathing regulation. Slow breathing or counting breaths lowers physiological arousal and prevents escalation. Small routines repeatedly, small routines repeated daily are more effective than sophisticated interventions. We aim predictability, comfort, and emotional safety. To conclude, Alzheimer's changes how a person experiences the world, but psychological support can preserve dignity and reduce suffering. If we listen, validate, and respond compassionately, we protect the person's identity and support their caregivers. Thank you.
Thank you, Doctor, for such a slightly and meaningful guidelines. We now to the question and answer section. You may post your questions in the chat box. I will read them out to our speakers one by one. Kindly keep your questions concise and relevant to today's theme.
I think the chat is disabled.
Yeah, it's the chat box is on now. We are facing some network glitches also. Okay, if there is no questions, we can move forward and we will send the YouTube link for the participants tomorrow.
Thank you, sir. There is no
Okay,
questions
so
yet. We will now bring
okay.
our Q&A section to a close. Once again, thank you to everyone for our participation and curiosity. Let's continue to share that we have learned today's help build a healthier, more informed community. I did now like a invite Dr. Vijit to deliver to close remarks.
Okay, so only the takeaway of this session is Alzheimer's is a progressive brain disease, but early detection, informed care, healthy lifestyle choices, and strong community support can make a meaningful difference for individuals and families. Survey Sandhu Niramaya. Let all be healthy. Namaste. Thank you.
On behalf of IAMS, I sincerely thank you all our speakers and participants. Alzheimer's care is a journey of patience, compassion, and knowledge. And today we hope we have added a clarity and strength to journey. Thank you all for joining us. Have a peaceful evening.